Hello, wonderful viewers, amazing viewers. Welcome to another episode of the Controversial Room. As you all know, you know what Controversial Room is all about. We are here to discuss controversial topics, controversial issues, a controversial topics whereby people feel uncomfortable talking about. And today, I'm not doing it alone. I have our guests here. I have Dr. Victor and Amati Ama. So, for you to see Dr. Victor, yeah, you know what it is. We are discussing our health, but first of all, we have to let them greet the audience.
Hello, viewers. It feels good to be back here. Just stay tuned.
Amati Ama.
I greet you once again. Stay tuned.
You know, it's a good day having you guys today. So, how have you been? How is everything?
Thank God.
It's been good. Today is Democracy Day. Very memorable day in our
And there is something you are not telling us.
in our country, and today happens to be my birthday.
Wow.
So today
yeah.
being June 12th,
12th, yeah.
is your birthday.
Oh,
So that's wonderful.
that's
Yeah.
good.
Don't worry, after the section,
I'm
you will
telling
now
you.
cut your cake.
It's
Yeah,
alright.
it
It's
calls for
alright. It's
celebration.
alright. Very important.
All right, moving on, ladies and gentlemen. Before we introduce the topic for today, we have to let you know you have a reason to subscribe that channel and hit the notification bell. You know, like I keep saying, we are uploading a lot of beautiful topics that you will kind of pay for you to learn. There are some situations you find yourself you have to have what is it called? So you have to pay consultation fee. Thank you so much. You have to pay but here we are dishing out for free. So this is why you should subscribe to the channel and hit the notification bell. So today we will be discussing on fibroid. You know, people have a misconception on fibroid. People believe that a woman with fibroid cannot give birth and other things. So that is why we have Dr. Victor here, and Amati Ama will also be, speaking on it too, and also asking questions, the one that I'm not able to ask. So, So Dr. Victor, you've heard our topic today.
Yeah.
We want to speak on fibroid.
Yes.
Like I said before, people have a misconception on fibroid. That this woman is with fibroid, or she cannot give birth. Can't you hear? Fibroid is running in their blood. They are, now. So don't go there. They don't give birth. So we want to know about fibroid, just in the layman terms. So we want to know about fibroid.
All right, viewers. Just as we always do on this platform, we make concepts very easy for our viewers to understand, and that's what we are going to do today. And in today's topic, just as the moderator has said, we'll be looking at fibroid as a topic. Now, fibroid is a very crucial topic in women's health that most people tend to neglect. You understand? And even those that maybe do not want to neglect it, they don't have a full understanding of what fibroid is all about. And because of that, it has led to a lot of misconception.
Yeah, exactly.
And even it has led to stigmatization in some ladies.
Yeah.
I can vividly hear you saying that some person that will say, this woman has fibroid, she cannot give birth to a child. So we are going to clear those misconceptions today. And that is the main reason you should always subscribe to this channel, so you learn
Definitely.
these things for free.
Okay.
So what is the meaning of fibroid? Okay. Remember, if you are filling up with this channel, we've discussed about cancer.
Exactly.
You understand? So it's like a series. So this fibroid is an outgrowth. They call it, in medical term, call it a benign outgrowth. When something is benign, it means it is not malignant. It is not cancerous. So it's a non-cancerous growth.
Yeah.
You understand? And this outgrowth, where do we find it? We find it in the womb. So it's an outgrowth found in the what? In the womb.
It must be in the womb.
Yes, in the womb. So it can be in the womb. It can be within the womb. It can be outside the womb. So this is what will now take us to the types of what? Fibroid.
Okay.
But before we go to the types of fibroid, fibroid is a very common issue. It's a very common ailment. And if you have 10 women out of 10 women, if you have 10 women, 6 to 8 out of those 10 might have fibroid.
Without knowing.
Yes, some of them will not know because the fibroid it depends on the size, the shape. Okay, some of them can be very small for it to be noticed, while others, they are very large. You understand?
Yeah.
So, but most women that come with fibroid, they don't know they have what? Fibroid, because maybe the size is very small, and that's what we call asymptomatic. They are not symptomatic, they don't show symptoms. Okay, so this will not take us. Yes, they don't show symptoms. So if they don't show symptoms, you will not come with any problem or any issue. Do you understand? Now, this will not take us to the various types of fibroid. The first one is the intramural fibroid. So when we say the fibroid is intramural, it simply means it is within the muscles of the womb. You understand? It is within the muscle. Then we have another one they call and this intramural fibroid is one of the most commonest type of fibroid. It does not cause infertility.
Okay.
Yes. Then we have another one they call the submucosal fibroid.
Okay. Let me cut you short. Just like people say, when people hear fibroid, they only assume that once they've heard fibroid, this woman is going to be able to conceive. So there are different types of fibroid. That the one that even if you have it, you can still conceive.
Yes.
So
like the intramural, that's why I said it depends on the type. There are some women that are asymptomatic, they don't show the symptom because it's not that significant. Its occurrence is not that significant.
Okay.
You understand? So that is the intramural. It's the most commonest. If you bring like 10 women here, 8 of them might have intramural fibroid, and it might not even show symptoms. But we are going to look at the signs and symptoms of fibroid. You understand? So that is the first one. Now the second one is the submucosal type of fibroid. Now that submucosal type of fibroid, if this is the womb, for instance, the heart growth will stay here.
Okay.
If this is a womb, the heart growth will begin here.
Inside the womb.
Yes, inside the womb, like beneath the womb. Now the heart growth, it will start protruding. Now when it starts protruding, it takes the position of the fetus. I don't know if you understand. There's an heart growth taking. This is the womb now, like a cup. Yeah. It takes the position of. Like this is the heart growth. Now it takes the position of it. So the egg cannot implant. So that's what they call the submucosal type of fibroid. Okay. And it's the type of fibroid that, if present, can cause infertility. You understand?
Yeah.
That's the submucosal. Then we have what they call the subserosal type of fibroid. So this fibroid is growing, if this is the womb, the fibroid is growing at the back of the womb, what they call the uterus. So it is not significant, it does not cause infertility. That is the subserosal type of fibroid. I also have what they call the pedunculated type of fibroid. Like a pedicle, it has a stalk.
Yeah.
But among all these fibroids that we have we just listed now, the ones that cause issue is the submucosal type of fibroid. So you see,
that grows inside.
Yeah, so you see, it's not when they say this lady has fibroid.
But is it always common in women?
It's not common. It's the intramural that is the most commonest. Okay. So that is why you can see ladies that have fibroid, they can still give birth to children. So it's not that you as a young guy, you want to get married to a lady and you just see some of the signs you are going to make mention of. You now say, I cannot get married to this lady. Or you begin to stigmatize this lady, or the society begins to stigmatize the lady. That is why education is very, very important.
Yeah, very,
okay.
Very important.
So apart from the types of fibroid, let's now go to the risk factors or the causes of this fibroid. Number one cause of fibroid is hormonal cause. Hormones. There's this two hormone they call estrogen and progesterone. So high level of estrogen and progesterone can cause fibroid. Do you know why? Because fibroid is commonly found in women that are in their reproductive age. And in the reproductive age simply means that most times when they take note or when they diagnose them of fibroid, they're already at their 30 to 50 years.
Wow.
You understand? So it's not that fibroid is not common among people at 20, 21 years. But before they will know that the fibroid is now there, these ladies, they might have reached up to 30 to 50 years. Because this estrogen and progesterone, you get them at a very high level during the reproductive age. So as far as you are a young lady, you've gotten to reproductive age where you can give birth to children, you are at a high risk of getting what? Fibroid. Okay. So we've made mention of the that number one hormonal factor, estrogen and what? Progesterone. Now the second risk factor is genetics.
Genetics.
Yes, you made mention of fibroid. It runs in the family. So there are some families you go, the mother, the aunties, the daughters, they always
Have fibroid.
have fibroid. You understand? So that one. So if maybe you see, okay, you've heard stories that your mother had fibroid, definitely you might have the fibroid.
Doc, you said here that between 8 to 10 women
Yes.
have
Fibroid.
fibroid.
I have chances of having fibroid.
In 10, yeah.
In everything, chances are that 8 women.
Yes.
So here you are talking about genetical factor as one of the causes. Does it not correlate that genetics has nothing to do with this, since it's almost everybody that has the risk of having fibroid? Or are you exclusively talking about the submucosa type of fibroid that causes infertility, or is it other type of fibroid? Because you've emphasized that fibroid, the other type of fibroid is common among women, but here you are still talking about genetic factors. As
okay. Now,
help me clear this.
Okay, let me clear it out now. Remember, I said intramural is the most commonest type of fibroid.
Yeah.
That means if you have 10 women now, and we said 8 of them will have fibroid.
This is a high number.
Yes, let's say 8 of them will have fibroid, or let's say 6 to 8 will have fibroid.
Okay.
It simply means in that 8 now we can say 6 we have intramural.
Okay.
Then maybe the remaining 2 we have submucosa.
Okay.
You understand? Then the remaining other 2 they don't have it.
Okay.
You understand? And when we say genetics, is a risk factor. Is a risk factor. Is one of the risk factor, because apart from genetics, we also have other causes, like hormonal factor.
About that one.
Yeah, you understand? So it might be that in a family they don't have this genetic trait there, but what is causing theirs might be due to hormone.
Okay.
I don't know if you understand. So apart from this hormone, there are also other risk factors like obesity.
Okay.
You understand? So
Obesity.
yes, obesity can. Those ladies that normally eat, we've talked about red meat. In cancer, they eat red meat, junk food. All those foods that contains cholesterol, they can be converted into estrogen. Okay. You understand? So that is a risk factor. You understand? So all these risk factors, when they sum them up, they will give you the general cause of fibroid, which among the commonest will be what? Intramural.
Okay.
Few of them will not come down with submucosal fibroid, because I've seen a pregnant woman in the hospital with fibroid who was pregnant. I think was up to 36 weeks, about to give birth. She had fibroid. So if you check very well, you see that type of fibroid might be intramural type of fibroid, not
submucosal. So what you are saying here that the intramural kind of fibroid does not portend any risk when it comes to childbirth.
But apart from childbirth, is there any other risk?
And I want to ask again, are there some other health-related risk associated with this kind of fibroid apart from childbirth?
Okay, so we've looked at the risk factors, which we've made mention of. We've made mention of 3 risk factors. Before we go into that, there's another risk factor again that can predispose someone to fibroid. Another one is early menstruation.
Okay.
Early menstruation can predispose a lady.
Now, you talked about this. Early menstruation. At what age do we consider a girl child to start experiencing early menstruation?
Okay, when you talk about puberty, there's an age grade for puberty.
Yeah.
When puberty begins, you see that secondary sex characteristics of a child has begin.
Yeah.
For girls, most times is actually from 8 to 13 years.
13.
Yes, 8 to 13 years. So
Okay.
sometimes when their puberty stage begin before 8, some of them begin from 5, 4. We call them precocious puberty. It's an
Okay.
abnormality.
Okay.
You understand? That's a
And
problem.
at this
From 5.
point,
Yes,
they,
that's
they,
from 5.
at this point, chances are that they may have started seeing their menstrual
Yes,
cycle.
they've started seeing the menstrual
That's fine.
cycle, and yes, it happens. They started seeing their menstrual cycle. Some people see their menstrual cycle. It's a range. Because
Yes.
human being, we deal with range. You cannot.
Yes.
That's why I use
We
the
cannot
range.
give exact.
So that I said 8 to 13 years.
Mhm.
But there are some girls they attain puberty or started seeing their menses from 6. You understand? 5. That's an abnormality.
Okay.
You understand? And when from 6 and 5 you started seeing your menses, it means your estrogen level has started peaking. Remember, estrogen and progesterone is the cause.
It's called number one.
And so
cause.
it simply means someone who is in 6 years or 5 years, started seeing their menses. Just like on a normal, if you are to follow the normal trend of aging, if they give birth to you first, definitely you should be the first to die. I don't know if you understand.
Yes.
So imagine someone who started seeing the menses first. Definitely, you should be the first to have the fibroid during your reproductive. Because you've started reproductive, you're now in your reproductive age. Like you started it already.
Okay.
I don't know if you understand.
Yeah.
Okay.
So that is it. So precocious puberty and all those things can predispose someone. That's what they call early menstruation.
Okay.
You understand? But when you get to menopause reduces the level of estrogen and progesterone.
Yes.
So that's why when a lady gets up to 50 years, 51, they are no longer predisposed to what? To fibroid. You understand? So
I've seen some women at that age with fibroid.
from 51,
I think
52.
okay, from 51.
When they've attained menopause, menopause is in Nigeria, it begins from 45 years.
Yeah, from 45.
45 going up.
And above.
Yes, you start seeing ladies with menopause in Nigeria, in Africa most times. You understand? So that is the risk factors which we've made mention. There are many risk factors that if we continue to mention here, we might not live here. So these are the basic risk factors.
Risk factors.
Yes, that will predispose someone or increase the chances of one having what? Fibroid. Now, let's now move to the signs and symptoms of fibroid. So that if you're a lady now, you're watching this video, you're learning about fibroid. How will I know I have fibroid? Before I will now rush to the hospital. Number 1 is heavy menstruation or heavy bleeding. During your cycle, you are bleeding heavily. You use many pads.
Menstrual pads.
Yes, you know that this is not normal. This is not normal because it's an outgrowth. It's something that grows. You understand? So that's heavy bleeding. Another one is painful menstruation. They call it dysmenorrhea. Yeah, painful menstruation. Every time you see your period, the pain is always severe, accompanied with a large amount of blood that comes out. Because you need to be very, very careful if you don't monitor it. Imagine someone losing more blood, a high level of blood. You might need to anemia. And when someone is anemic, it can cause a lot of things. You understand? So the second sign or the third sign is you see this person, they will have this bowel problem, constipation. Because this outgrowth, if you take a look at the shape of the female reproductive organ, the uterus, the uterus and the bladder, they are closely related. So just imagine an outgrowth in the uterus, and the outgrowth is increasing, the size is getting big. It's going to compress on the bladder. It's also going to compress on the large intestine. And when it compresses on the large intestine and it compresses on the bladder, for the large intestine, the person will have constipation. If any time the person eats food, the person will feel as if the thing is not going down, it's not digesting. Okay. That is a symptom for that particular person. And also frequent urination. Because the outgrowth is compressed on the bladder. So the person always urinates. Yes. Another one again is that imagine the outgrowth. There will be pelvic pain. When the outgrowth hits on the pelvic bones and the rest, so the person might come with pelvic pain. So when you see these signs, these symptoms, you need to go to the hospital so that they will run a test on you, they will run an examination on you and know how to treat this condition. But it's not something that when it happens you should be scared. You understand? It depends on the type of fibroid.
I've heard of a situation whereby someone has a fibroid. She gone to the hospital and confirmed that is fibroid. Then doctor advised it has to grow to a certain amount, like a large amount of this thing, a certain size before it can be operated.
Okay. You know, when we started, we said some of these fibroid, they don't show symptoms. Why? They are very small. Out of those 8 people that have those fibroid we talk about, 7 of them might not even show symptoms. It might be small. Some will not even notice except they go to the hospital to do tests. But the ones that normally show symptoms are the ones that are very large. Okay. They've grown. If I see a lady here now with fibroid, I don't even need to go to do ultrasound. Maybe looking at it, I already know that this person might be having fibroid because of the outgrowth. You know, that one is a kind of severe issue. And definitely, if you ask that lady, how is your menstrual flow like? The day is very heavy. You understand? So those ones that are very large shows a concern. And secondly, it's not something you just take someone to the theater and you want to remove it. You have to be very, very careful. Treatment depends on if the lady is a young lady or if the lady has aged. Because the definite treatment, because this fibroid, even if you take the person to the theater and you remove it, it has a high chance of reoccurrence. Okay. For every fibroid you remove, definitely to come back.
It's one of the questions I want to ask you. Yeah. If fibroid can reoccur.
It can reoccur. That is why the definite treatment of fibroid is a procedure they call hysterectomy, removal of the womb. You have to remove the lady womb so that it's not reoccurring.
So you cannot regrow again.
Yes. So when the womb is out, where is the fibroid going to go?
That's if you are done.
That's why I told you it depends. If you're not giving birth, so that's if you've not given birth, you don't take the person to the theater and remove the womb. So you have to check it. This person is. There are a lot of conditions you need to check.
My question is still, apart from difficult in childbirth or not being able to conceive, are there other health-related?
That is the complications we just talked about. Constipation.
Okay.
Pelvic pain. Frequent urination. Is a benign. Remember we started, it's a benign. It's non-cancerous. It does not cause any harm. Except the complications that might arise from it. Imagine someone losing blood every time. Anemia.
Okay.
Imagine the outgrowth increasing, constipation. And you know it's not good.
Yes.
It can lead to obstruction, can cause other issues. That's why when the size is getting large and getting very big, it needs to be removed. If that lady is still giving birth to children.
Doctor, apart from surgery, are there other way of getting this fibroid treated? Or
Yes.
Getting rid of it.
Getting rid of
Can
it
you
without
get rid of? That's it should even be the question. Like,
there's something they call, if you want to look at the treatment of fibroid, there's what they call pharmacological treatment. That's medical treatment. There's also what they call surgical treatment. So in the medical treatment, there are some drugs you take. It will shrink the size of the fibroid. You continue taking that drug. It works. There are some drugs you give it to control the amount of the hormones in the person's body. You understand? So that is medical treatment. But that does not mean that even when you stop taking those drugs, it will come back again. You understand?
So that is to tell you that you have to be continually taking that.
Yeah, when you go and you have to go to the hospital and they will prescribe the drug. There are some situations whereby it's something drug can no longer do because the size is not getting too big. Even before they do you the operation, they are still going to give you those drugs to shrink that fibroid. If not, after this segment, I need to show you the size of a fibroid. I think you add it to this video, so they will see what it looks like. A fibroid can look as large as this my head. I'm telling you, they remove it from the woman's womb, and you'll be like, imagine.
As large
as my head. I imagine.
On top that they still shrink it for you to get to this size. That is bigger than this.
It's very, very big. You get very, very big. And imagine, and if that kind of fibroid is inside someone's womb, imagine the kind of complication might arise. Constipation, compression of the bladder, the pelvic pain. You understand? And if imagine it's not a submucosal type of fibroid, where would the baby stay if my head is there? Raising it. It has no place
I
for the
understand.
baby to stay. So it can lead to miscarriage. You see people talking about miscarriage. You see a couple talking about how they've given birth to 1, 2, but they're always having miscarriage. When they check, they say it's a submucosal type of fibroid. So if it's a submucosal type of fibroid, something needs to be done. You understand? But if maybe it's an intramural, they do conservative management. They watch the fibroid, the size. Is it growing? Is it something that will not cause any complication? You understand? Because intramural, definitely you can give birth. But we're looking at the complication of that intramural fibroid. Is it growing? Is it increasing in size? What are the complications? Is this patient anemic? Now, okay, go to the theater and remove it. But the definite treatment is hysterectomy, removal of the womb. And I want to say something, please, because I've met with some people, some patients, even while walking on the road, people will come and tell you that they've gotten a cure for fibroid. They call it herbal medicine. You see them preaching it on the road. If you drink this, it will cure your fibroid. Please, that's a big lie. There's nothing like that. These are some of us come down with liver problems, liver cirrhosis, chronic liver diseases, cancer. You take herbs that does not even have dosage. You just drink it and you're killing your liver. Please, there's nothing like that.
So
there's
you talked about complete removal of the womb.
Yeah.
What happens if the woman is still within the childbearing age?
Yeah. If the woman is still within the childbearing age, number one, you have to check, is it type of fibroid? Is it intramural? Is it submucosa?
Let's just say submucosa.
Now, if it is submucosa, you need to take the woman to the theater and remove the submucosa fibroid.
Okay, you don't have to remove the womb.
I've seen some situation where
you remove the submucosa type of fibroid and observe.
Okay.
And observe, you observe and see
if it will regrow.
Yeah, and observe if the because when you remove it, it will take time to grow again.
Okay.
So you observe and see if they can still give birth. Okay. If maybe that is the main cause of the infertility. So, and definitely most time when they remove it, you see the couple, they conceive.
Birth to a child.
You understand? Okay. So that is it. That's why we need to be enlightened. It's not something that deep. Even you as a man, you have someone you love. And after everything, nowadays they do go for medical checkup before people get married. Or the lady just open up to you that, I have fibroid though. It's not enough reason for you to cancel the marriage.
Why? Because given this misconception, before, if not that I've been enlightened, because no man will likely go into a marriage where knowing full well I cannot conceive. And not every man have this opportunity to be enlightened as I am. So what do you say in this situation?
Yeah, that is why we are here. That's why we are giving this sensitization.
Definitely, that's
because I know many people that have missed the love of their life because of fibroid. Even there was one day in the clinic that we had a lady come into our clinic. And the reason why the lady came to the clinic was because of issue with the fiancé, because of the fibroid. So she was looking for a way if they can remove it, because the fiancé has been complaining too much. A very young lady of 25 years or 26 years, that the fiancé, we've not done the examination, we've not done the ultrasound to check those things, because you do ultrasound to check if it's submucosa is this. So we're now trying to do some examination and the rest, and told her that it's not something you should be bothering yourself. Is it disturbing you? Is it causing this? Is it causing that? If it's not something that you should be, if it's not submucosa, you shouldn't be worried. And we really need to talk to your fiancé. Should I educate him that it's not all type of fibroid will lead to what? Infertility. And so that is why we are giving out this enlightenment here, so that people should know. Not when you hear the word fibroid from a lady, you'll be like, I cannot get married to anyone fibroid. Not knowing that even out of 10 women, 8 of them have fibroid. Just that it's not large enough to be seen.
Okay, I want to ask you, Doc, because I've heard numerous news concerning this fibroid, where maybe I guess it's submucosal fibroid, where a lady was taken to theater for to remove the fibroid in particular. At the end of the day, they end up losing their life, because they do say it's 50-50 chance or stuff like that.
Yeah, thank you so much for this wonderful question.
Mm.
With the advancement of technology, I'm not even scared of surgery now.
Okay.
With the advancement of technology and dealing with experts, I'm not really scared of surgery. Nowadays, we do surgery when the patient, they are awake, they don't even sleep. They are seeing you doing the surgery. They call this thing regional anesthesia. It's not general anesthesia. You'll be awake. Most of the private operation or the fibroid we've done, like I've been involved in the theater, we do interact with the patient.
Why doing
it?
Because it's true. Because when
I don't know
had
if you've
appendix,
experienced it.
I was
awake
with
them.
interacting with them.
We interact with them, we talk
and
with
I
them.
And I was not experiencing the pain.
You will not feel any pain. We talk.
I was
and
awake.
We talk and we interact. You see them interacting with you and everything. They close up, they suture when they are done removing all the fibroid. They will show it to the patient. So that's why we talk about dealing with experts and not dealing with quacks. When you want to maybe maneuver the process, and someone will just call you, let me take you to this hospital, one quack, or I know someone who can do it at a cheaper rate for you.
Quacks, what you see, because in all of this, it runs on cost.
Yes.
So is this fibroid surgery, how manageable in terms of cost can it be? Because sometimes many people or these women may be going through these existential health issues and they wouldn't want to go to the hospital. That's why they end up drinking those abo. And because they think that the surgery, is this something that is bigger that their hand cannot contain it, or is it something that everyone can afford?
One thing about health is they say health is wealth. But before that, that is why we have private hospitals, we have government hospitals, we have federal hospitals that have subsidized most of all these things. You understand? I won't tell you that the cost is expensive or is cheap. But I think for someone who has fibroid, a submucosal type of fibroid, and is looking for a child. Remember, people who are looking for a child, I'm saying this based on experience, there's nothing they will not do.
Yeah.
They go out here, I've experienced it, I've seen it. There's nothing you tell them they should do, they will not do just to get it to be able to conceive. You understand? Because when you take a look at two entities, you try to outweigh the one that is more important than the other. You get? So most of them, they have the money to do it. But the problem from what I've experienced is not even money. Because we have government hospital, we do refer them that, okay, we can do this here at this hospital, we can do this at this hospital, look at the prices, you can compare. I know the one you can do. You understand? But what I found out most times, the reason why most people have not done this surgery is because, just as what you said, that they feel that when they do the surgery, they might not make it. I've had one-on-one encounter with most of them.
Because that's I don't know if it's a misconception or what, because I have that idea of, because I've seen it countless times, whereby people losing their life, whereby they are operating fibroid.
I know of someone who has fibroid, and the reason why she has not done the operation is because she's scared
of the surgery.
After the surgery, she will not make it. Even after they referred her, they even reduce the cost. They referred her to a hospital, they even reduce the cost. She said she's not going to do it because she's afraid she will not make it. Even after the enlightenment and everything. And she's still with the fibroid up till now.
And that's a risk.
That's a big risk. Every time she sees her cycle, it's very, very heavy. I know
most times they will be praying so that they won't see their cycle.
It's so anemic. So I'm using this medium to let you know, if you are listening or if you are watching this video,
no need to be afraid.
If you've been diagnosed of this condition, speak with your doctor, have a one-on-one interaction with your doctor, and they will tell you the best thing to do. If it calls for surgery, please find the money and do the surgery. Your life is very, very important. Most time we say without money, there's no money. But when the main problem comes, we'll go and find the money. It might not be in the severe form or the chronic stage. and you say you don't have money, when it enters the severe form, when the complications are now started arising, you will see them, they will go and get the money. It happens most times.
But don't you think that all this over dependence in spirituality contributing why many people abscond from doing this fibroid surgery?
Yes, it's
How
also
does it contribute?
it's also another factor. We're all Africans.
Yeah.
I know you being an African man, life is always 1-0 ahead of you, because even having a black ancestry predisposes you to having fibroid. That is why you hardly see people from the West having fibroid, or if any of them have fibroid, they do come to Nigeria to do that. Yes, because we are experts. These are surgeons that do that particular operation. We are experts in doing myomectomy, which they call it. We are experts. There are doctors there because they don't see those cases now. For you to be good in something, you should be doing it every day. Yeah, there's no day in UNTH that they don't see cases. They don't even do cases of myomectomy or fibroid operation, moving fibroid. So they refer them to Africa here in Nigeria and we do the operation very well, neatly, as if nothing happened. You understand? So spirituality also has a role, because you are in Africa. What are you expecting? We always depend on spirituality, even when the solutions is clear and is lucid, is in front of us. We just want to pray and pray without working. But then that's why we are trying to enlighten people now to know that you pray but still do the needful. It's not something that deep. It's not something that serious or that chronic. If the thing is disturbing you, for it to disturb you, it simply means it's now getting large. Because those smaller ones, it will not even show any sign. It will be dead till you even leave this earth. You will not see any problem with it. So we should be enlightened, please.
Okay. All right. Thank you so much, Dr. Victor. Mr. Matiam, I don't know if you have any question to
I don't have any further question. He has
all right.
cleared
So
my
before
concern.
we finally wrap it up for the day, I don't know if Dr. Victor still have anything to say, your final words towards the viewers.
So I'm still using this opportunity to ponder on what fibroid is all about, just to give you a summary of what you should know. Fibroid is a benign outgrowth found in the uterus, that's in the womb. You understand? Now we have different type of fibroid. You get? So the severity of the fibroid depends on the type. You understand? There are some that does not cause infertility. Out of all the fibroid, it's only one that can cause infertility, which is the submucosa. So the other fibroid, and it's not even the most commonest type of fibroid. The intramural, which is the most commonest, is there. The pedunculated is there. The subserosa is there. They don't cause infertility. So don't stigmatize anybody because you see a lady's abdomen is distended, or you see it swelling. You not call this lady has fibroid, because most ladies that they see with enlarged big tummy, most times is an indication though that this phase most times is an indication that fibroid is there, because at the tummy the lower abdomen is always enlarged. You understand? But it might not be submucosa type of fibroid, and this person might be the love of your life, someone who you've seen the future with, and you as a young man, you now come to a conclusion that I've heard this story from this place, so and my mother said this family always have this, they always have fibroid in their family, I'm not going to get married to that person. No, you shouldn't think like that. I think you should support her. You can go for tests and screening, and even if it's at the end of the day is submucosal fibroid, that shouldn't be enough reason for you to say you will not proceed with the marriage, because submucosal fibroid, when detected, can also be managed, can be operated on. Some men might say, okay, I don't have that money and all those kind of things. But do you know that there are other sicknesses that are even more chronic or more dangerous than fibroid? Fibroid is a benign issue. So we should all be enlightened. Please don't stigmatize anybody, any lady
at all.
Please don't stigmatize any lady with that particular condition. Support them. And if there is any way you can give them emotional support as a guy or you are the husband, please do well to do that. That is just my last few words for us.
All right. Thank you so much, Dr. Victor. Mr. Matiama, your final thoughts.
You've heard from the medical doctor here, and above all, stop over spiritualizing everything. all this God forbid is not my portion.
It's not my portion.
Whose
portion is it?
God can hear me kind of ideology or mindset is not going to save you in this situation. When it happens, the best thing is to run a medical examination. And to the young men, just like Dr. Vic has emphasized, that it's not enough to run away and stop
the beautiful relationship you are having
and stop the marriage or the relationship.
See big belly, you can't run
because of all this superstitious belief that this woman, their family normally do not give birth to a child. They have a history of fibroid. Sometimes it's not true. I just want to say that in situations like this, you take a step towards finding out the real cause of the problem and give your maximum support to much you can give, and build that lasting family that you have always dreamed about. Thank you for staying tuned, and next time we got you.
After this, you have to celebrate.
Yeah, very, very important, very, very necessary.
Yeah. All right, ladies and gentlemen, thank you so much for staying up till now. And if you are still here, you've seen the wonderful topics we've been talking, we've been discussing, we've been analyzing. So this is a very great opportunity. Share this video. Make sure you share this video to get to someone that knows someone. So you have to subscribe and hit the notification bell. I'm still your humble host, Prince Ewuzie. So guys, we have to wave goodbye to
Goodbye and stay healthy.
All right, see you on our next video, guys.
Thank you.
Bye.